A leaked memo over the weekend from FDA's top vaccine regulator is shedding more light on the problems that the Trump administration needs to address and tackle in order to get the agency back to its mission of protecting public health and restoring public trust in the government. So in this memo to the staff at the FDA Center for Biologics Evaluation and Research, the director, Vinay Prasad, highlights the failures of the reporting system for deaths related to COVID-19 shots and the failure to act on or even acknowledge that that data was available. Now, Dr. Prasad also discussed the path forward, which he said will see vaccine regulation directed toward evidence-based medicine, something that is in line with what we've been hearing from other officials at the Department of Health and Human Services. So, how significant is this moment, and will change come? Joining me in studio to talk about this, Dr. Chris Gacek, Senior Fellow for Regulatory Affairs here at the Family Research Council. Chris, thanks so much for joining me today.
Good to be here, Tony.
All right, so this is pretty significant.
Absolutely. We've had Dr. Robert Malone on the program a few times, and he, in a couple of posts, Substack columns, one of them he said was that he was just flabbergasted. He never thought in his lifetime he would see a document like this that was reviewing all of the problems in the vaccine space.
And we have children who were forced to get this vaccine, and they died.
Right. And so Prasad had data before him about vaccine injuries, and then he had apparently another epidemiologist come in, like a sort of somebody who's a real specialist in digging out the issues. They've so far in this sample of the adverse event reports, they found 10 deaths that they consider to be likely caused by the vaccine.
Okay, so
in children. So
we back during COVID, when this program was on talking about this, in fact, we got flagged for raising this issue about children being forced to get the vaccine who were healthy, who didn't need it. In fact, it's better sometimes for children to get these things because they build up a immunity to it, especially if they're healthy, if they don't have any other morbidities. So that's one issue that wasn't considered in this process. But then there was not a systematic reporting of these adverse effects.
Well, and so let me go back to your first point, which is you're absolutely correct. And this is sort of the guts of it. There was a huge controversy at the time about, look, maybe give the vaccine to the people who are at risk. If you're over 65, right? And people who have
be careful. Be careful how old.
And people with certain kinds of characteristics.
Well, I mean, they had other secondary effects that could be, made worse by COVID.
Sure. But they knew that this population of children it was very, very low probability that anything would happen to them. And so this was a very touchy issue. And what Prasad...
But that wasn't even considered in the protocols.
Right. And it was, in fact, he lays this out in such a way that it's scathing. The document is in sort of... He says, why did the commissioner himself, this is Makary, have to come up with this information and get it to you before we found out that these 10 deaths had occurred. In other words, the staff itself had not been doing the work it should have been doing.
So this information was available to them?
Yes.
And they just didn't, they didn't report on it, they didn't release it?
They didn't analyze it properly, they didn't, whether it was either corruption or dishonesty or ideological blindness, they didn't do the digging and the work that was necessary. And Prasad and Makary, I think, had actually studied this outside, before they came into office, and they went right there. And so they are not going to lose this argument, by the way, the two of them, because this is the strongest case. And they have been they picked a very careful place. They have somebody working on it who was very methodical, and they've done a very smart thing here.
So in part, what they're talking about in terms of going forward is reorient vaccine regulations toward evidence-based medicine, not speculative. Require randomized clinical trials measuring real-world outcomes, again, before they put these things into wide application. What about the reporting of these adverse effects?
Well, right. I mean, one of the things that's a problem is you need better reporting. And this is a problem that we have with drugs and with vaccines. But remember, some of the things that they did in the whole process with the FDA is that, with the COVID vaccines, is that you always have a control group, right? But they wiped out the control groups because they said it was unethical to keep a control group when you have a vaccine that works. But this is not kosher, because if you don't have a control group, you can't tell these.
Well, it's not good science.
It's not good science, but it's a trick that the FDA has allowed to be played over and over and over again. And I think it's dishonest, and it's meant to cover up the evidence of bad things.
What do you think will be the outcome of this report?
I think it's going to change a lot. The report itself, the 6-page letter, is basically a memo, a signpost of where they're going, and they are going to be aggressively going in a direction that is very powerful, science-based. They're going to sweep away all these sort of ideological presuppositions. And I think the FDA itself is in a mood, and this is why I think this is an important topic for other things like Mifepristone,
which we're going to talk about in a moment.
And in other words, they're starting to look at a lot of preconceptions and a lot of problems that have occurred because you couldn't challenge the orthodoxies inside these various stovepipes at the FDA.
So Chris, we're going to talk about the Mifepristone here in a moment with our next guest. But in order to cement change, because you get another. I was just talking earlier with Scott Perry about how our government's going back and forth with its policies based on elections. You have to put certain things in place. One of the things I think is needed is a systematic reporting mechanism, so that we're looking across the board at, as you mentioned, not just vaccines but drugs. In Mifepristone, we're looking at the adverse effects in a very systematic way, and the reporting is systematic so that we can evaluate the effectiveness.
I agree completely, and this is one of the things I think Dr. Altman is going to talk about is, the criteria that can be used to evaluate adverse events on the drug side, and that there really isn't a proper criteria. But I won't go into that. But let me just say that what's clear is that Makary and Prasad on the vaccine side are just, it's almost like they're just throwing out all of the sacred cows, and they're just going to start. And what we need to do is urge them and give them applause, but say, let's do this on the drug side, and let's go back and look at what was going on.
I think it's the only thing that will restore any type of confidence in our public health system. Right, and it's going to be a tough fight. I mean, for these, but I don't trust them. Right. No, I mean, and they destroyed the trust. CDC did, NIH did, and but the only way I don't think they realize that the only people who would help them get it back are people like Secretary Kennedy and Prasad and Makary, because they're fighting this memo tooth and nail, from what I can tell. I know. I've seen the reports on that. Chris Gacek, thanks so much for joining us. You're welcome.